next intervention, I had a patient who was on the younger side trying to pick up an Eliquis starter pack. She had a blood clot in her arm. Insurance actually ended up paying for it, but it was legitimately $700. So I decided to call the hospital, and I got a hold of the operator. I'm like, hey, transfer me to inpatient pharmacy, because I like to talk to pharmacists to get like things done with coupons and stuff. So I talked to the pharmacist. I'm like, hey, can you enroll this patient real quick for the free trial card? Because I have databases at Methodist Hospital that they can just pull up sample cards and they'll just randomly auto-populate. And she gave it to me over the phone for this patient that was recently discharged. So these free trial cards are not available online. And then also retail pharmacists like can't call for them. They're like inpatient or like hospital or practitioner cards only. So I've asked before for Eliquis or Bristol Myers Squibb to give me those, and they said no. But I got this card for her real quick, and it was free. So it dropped from $700 to $0. So she picked up her Eliquis, and then I also talked to her about the $10 like copay card that she could enroll in for her continued fills, because she's going to be on it for a while because it was an unprovoked clot. Next intervention was I had a patient who was previously on Mounjaro 12.5, and then their provider switched them to Zepbound, but they ended up putting them on the 5 milligram. So Mounjaro and Zepbound are both tirzepatide. They're both the exact same medication, just different brands, different indications. So I talked to that patient like, hey, your dose got docked down like twice because it comes as 2.5, 5, 7.5, 10, 12.5, and 15. So their dose went down to basically 2 doses. So maybe the provider thought they were different drugs and was using the idea of incomplete cross-tolerance. Cross-tolerance is when you get, when a patient's tolerant on one medication and they're going to be tolerant to this, like another medication in the same drug class, but incomplete cross-tolerance is they're not like fully tolerant to the medications within the same drug class. This is kind of like the term we use for opioids. Like when we change patients from opioid to opioid and they're tolerant on them, we'll usually decrease the dose by like 50%. But this was interesting. I told them basically their dose was chopped down.